Welcome to Video 3, Navigating Your Recovery. In this video, you will learn how to be an active participant in your recovery after surgery. We will review the steps needed to be taken by you and your team to ensure the most success in your recovery process. When you wake up from surgery, you may be groggy initially due to the medications you received in surgery. You will be in the recovery room until your anesthesiologist has deemed you sufficiently recovered from anesthesia to be moved. You will then be transported to one of our overnight recovery suites. Your caregiver may stay the night with you in the recovery suite if they would like, or join you the following morning. You will also notice sequential pumping on your legs from a compression device. This will be there to help prevent blood clots. You may also have a catheter in place until you are able to get up and urinate on your own. Your surgeon will meet you early in the morning to do one last post-operative check. While at the center, if you experience anything unusual, such as nausea or pain, it is important to let your nurse know, as there are medications you can be given to assist with this. Your nurse will also give you pain medication in advance of your physical therapy sessions. We will also take care of all of your meals during your stay. Please start with light foods first. Feel free to let your nurse know if you would like to order something. During your time in the overnight recovery room, it is important that you do not attempt to get out of bed without your physical therapist or nurse with you. Most patients are able to be up and walking within hours of surgery. Controlling your pain is a very important part of your recovery. Too much pain will keep you from being able to do your exercises and physical therapy, which are crucial to getting you back to your feet sooner. It is important that you follow the instructions you are given about your pain medication. This is especially important when your anesthesia begins to wear off. You will want to stay ahead of your pain. Take your medication as prescribed for the first 2 days. You will be discharged from the center and free to go home after you have been seen by your surgeon and physical therapist, and they have determined that you are safely moving around and are able to get in and out of bed. You can get to the bathroom on your own. You are tolerating food, your vital signs are normal, and you can control your pain with oral medication. This is generally around 7 a.m. You will not be allowed to drive yourself home. Your caregiver will need to be available to pick you up and drive you home. Your caregiver will also need to stay with you for at least the first 72 hours following surgery. Your surgeon will order home health services, including physical therapy tailored to your home needs. A therapist will continue assisting you with your home exercise program. A nurse may also be available to monitor and manage your pain control, incision care, and may take a blood sample to monitor your blood count. Your home care team will coordinate with your physician to help you with the transition to outpatient rehabilitation. A physical therapist should come to your home the day you arrive from the surgery center. If a physical therapist does not show up, please call the patient care coordinator at our center. Even as you are recovering in the comfort of your own home, the staff of the Presidio Surgery Center remains dedicated to your successful recovery and physical therapy. Make sure you have your surgeon's after-hours phone number. This is who you should reach out to if you are not able to manage any of your symptoms. If you have active bleeding that is not being controlled with a new bandage, please contact your surgeon immediately. Ice and elevation of the extremity can lessen bleeding. Remember to wash your hands before touching the incision area. Keep the surgical area clean, dry, and protected. Remain active and complete your recovery exercises as determined with your physical therapist, and do not miss any of your therapy appointments. Watch for signs of infection. Typical symptoms of infection include increasing redness, swelling around the incision, drainage from the wound, difficulty walking, and a persistent elevated temperature. Most patients experience a low temperature for 1 to 5 days after surgery. This is a typical reaction to the anesthesia. Temperatures that are above 101.3 and persist despite Tylenol and deep breathing exercises are worrisome for an infection. If you experience any symptom that concerns you for an infection, please contact your physician's office immediately. Thank you for watching the Presidio Surgery Center's informational series. If you have any other questions or concerns, please call your patient care coordinator or feel free to ask any of our staff in person during your pre-op class.